The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to today's educational webinar. Today's topic is on the new group purchasing program available through Physician Partners and the Physician Resource Center. Today's guest speaker is from Medline. We have Robbie Siegel. Robbie Siegel is the Western Division Manager with Medline. A couple other notes real quick before we get started. Everybody's muted just to avoid any background noise during the presentation. If you have any questions, however, you can type them into the GoToWebinar panel on your screen, and at the end of the presentation, we'll answer them in the order in which they have arrived. So without further ado, Robbie, thanks for doing the presentation with us today.
Thank you so much, Dustin and Veronica. We're excited to be here and excited to be a part of the program. So let's go ahead and get started. My name is Robbie Siegel. I've got my contact information up on the screen. I'm the Western U.S. Division Manager for Medline, and then we have two salespeople that call on the San Diego market for us as well, and they may or may not be on the line right now. Kelly Lovett, she covers the San Diego and the downtown area all the way south, and then we have Maria White that covers the northern San Diego area. So depending on where you're at in San Diego, these would be our two representatives that would help you directly on a day-to-day basis, and there's their contact information. Some of you may or may not have heard of Medline through your years working in the healthcare industry. So I want to do a little quick slide on why Medline. We're actually a pretty big company. We're an older company as well. We've been around since 1910. We're family owned. We're actually the largest privately held manufacturer and distributor of healthcare products in the U.S. If you've spent some time in hospitals anywhere in the country, and specifically in Southern California, you've probably seen us. We do a lot of business in hospitals, surgery centers, long-term care, nursing, those sorts of facilities. And a few years ago, and I'll explain more on that, we moved into the physician office market and are doing more and more business specifically with physician offices. We have zero debt. We're privately held. We've got 1,100 sales representatives and specialists across the country, and a little different than companies you've previously worked with. Because we're a manufacturer, not just a distributor, we have a lot of clinical specialists for the products that we specifically manufacture as well. We have 36 distribution centers, and we're actually the worldwide leader in sales of exam gloves and a national leader in skincare products, OR kits, incontinence products, and things like that here in the U.S. So very big company, do a lot of sales. We hope to treat you more like a family-owned company that we are. So really, the Medline difference and why I think you guys should be interested in Medline and what differentiates us from our competition, to begin with, is that we are a manufacturer. Because we're a manufacturer, we cut a piece out of the supply chain. Our competitors have what they call private label goods. So they might have their name attached to a box of gloves or a box of needles or a box of syringes, but the reality is they buy those from someone else. They have to mark them up, and then they have to sell them to customers. That's the way how distribution works. Because we're the manufacturer of over 125,000 products, we remove a piece of the supply chain and are able to get those products to you at a lower cost. And at the end of the day, all of you are trying to remain relevant in healthcare, keep your practices successful and profitable, obviously, and being able to reduce costs on your medical supplies is generally a good thing, and what we're here to try to help you. So buying direct from the manufacturer obviously saves you money. As I said before, we cover the full continuum of care. We're a market leader in hospitals, nursing homes, surgery centers, and recently entered the physician office market in the past few years, and we cover home care and retail. And the reason we entered the physician market was because our clients, our hospitals and our IDNs and healthcare systems, they're entering the physician market in a stronger way. And they really pulled us into this market and said, look, we now work with a lot of medical practices. We own a lot of medical groups. So we found it necessary to launch a physician office team. These are reps similar to the reps that currently call on your office with our competitors. They're dedicated to the physician office market. This is all they do every day is call on your customers. So call on your offices. So something very important to understand is that we have a separate group of sales reps that call on hospitals, a separate group of sales reps that call on nursing homes, a separate group of sales reps that call on surgery centers. So The reps that we have, those two that you saw on the first slide, Kelly and Maria, are dedicated 100% to physician offices. And we hope to be able to do a good job servicing you guys in the future. This is kind of just, you know, a slide of all the different things we cover in healthcare. You may have, if you've done any work with Scripps or worked in any of the Scripps facilities, we are the Scripps Health prime vendor. So we do all of the business for all of the Scripps hospitals in San Diego, as well as all of the Scripps clinics throughout San Diego. So you can feel very confident that we can service your offices very effectively as well. And you know, I know a lot of people think of Scripps as this large entity that delivers, that receives things on pallets and more like a hospital entity, but believe it or not, their clinics and even a lot of their locations within the hospitals we have to deal with on a very small level, very low unit of measure. So we're very prepared to handle your offices and are doing so effectively already in a number of cases. You may have heard of some of our products. Probably the most common name people hear is Curad. Everybody's heard of Curad Band-Aids. We are Curad, so we use brand names like Curad and Remedy and AlloTouch on our products, but we are the actual manufacturer of those products. No different when you go into a Costco or a Walgreens or a CVS or Save-On. Most of the wound care products, the gloves, the gauze, the Band-Aids, those products are actually manufactured by Medline, and we put those in their packaging as part of our private label program as well. The distribution center that would service your offices is in San Bernardino, so we're very close by. We have a distribution center. By the end of the year, we'll have over 1 million square feet of distribution center space in Southern California. We do about $7 billion in annual sales, and we are family owned, 4th generation. So it's a wonderful story, and I'll make it very brief, but the great-grandfather of the family that is now running Medline started in 1910 making gowns for surgeons. He actually made gowns for butchers and realized that surgeons deal with a lot of blood and started making gowns and came up with the innovative idea to make those gowns in blues and greens to ease the eyes of surgeons that were in long, long surgeries. And that was kind of the impetus of what today is Medline. Very proud company. We've got over 9,000 employees throughout the world. Some of the products that we manufacture, just to give you an idea, because these are the products that we're going to be able to provide you the most cost savings on. We manufacture a lot of different apparel, like I just covered. We're really a national leader in wound care products, lancets, janitorial, soaps, all the paper products, all the gauze, the Seafold towels, the table paper, we manufacture those all ourselves. Ointments and pads, everything related to those wound care products. A lot of diagnostics products, gloves obviously, and we do manufacture a lot of our CLIA wave testing for pregnancy and things like that, and rapid urine tests. We are innovative, and that's an exciting reason for you to want to partner with Medline. As a manufacturer, we have a lot of people that approach us that are delivering innovative products to the market and want us to help bring their products to market. And so a lot of times working with Medline, you'll have the opportunity with new products before they would have been identified by other companies. A great product that we just innovated is what's called the BioMask. This is the first ever FDA cleared antiviral face mask. Most face masks do a great job of protecting the person wearing the mask, but all of the viruses and all of the bacteria still live on the outside of the mask, and if somebody coughs or if they rub that against somebody and they touch somebody with it, they can pass those viruses. Ours is actually both antiviral inside and out, 99.9%. It's the first ever, and these are the kinds of products you can expect from Medline and the kind of innovation that you can expect from Medline if you do business with us in the future. We do have momentum, and you can see these are since 1995. This is our growth. So you'd be partnering with a company that's obviously moving in the right direction, still privately held, and lots of support and services for our clients. You don't have to worry about if you do work with Medline in the future. We do carry all of the traditional product brands that you're probably used to, Welch Allyn and Johnson & Johnson and BD and 3M. We have all of those products in addition to the ones we manufacture. What happened is we were manufacturing products. We were like one of these companies. We sold through distributors in the hospital, and eventually we started manufacturing so many of those products, and they were buying so many from us. We said, why don't we become the distributor, and then we'll just buy some of these products as well and put them on our shelves in our distribution center. So we kind of switched from being just a manufacturer to a distributor and a manufacturer maybe about 15, 20 years ago. That went very well in the hospital market, then the long-term care market and surgery centers, and now we're obviously moving into the physician market even stronger. This is a snapshot of what one of our distribution facilities looks like. If you do business with us, you'll find out we have a 3 p.m. ordering cutoff. We do offer that 3 p.m. cutoff will get you next day delivery. We have a very low unit of measure delivery, so a lot of people feel like because we're started as a hospital company, we might only deliver in cases and pallets. We actually sell table paper by the roll. We actually sell needles by the each. You don't even have to buy a whole box, and we do this because a lot of hospitals now have moved to a bin system where they get everything in a tote, and we break the unit of measure down all the way to the lowest possible unit of measure available. We can schedule deliveries and be accommodated, and all of our deliveries are via FedEx ground. We're actually the third largest customer for FedEx in the United States. So FedEx does a lot of business with us, and when we say jump, they do say how high. So if you like what you're hearing so far and you wanted to have an analysis done for your office, this is a little bit of a timeline of what we do. First of all, you'll see that at minimum, we will guarantee you an 8% savings, period. We feel confident that we can tell you that. We'll guarantee you no less than that. Most of our clients are receiving in excess of 15% savings. You would notify partners, physician partners, of your interest to be a part of the program. You'd get us the material usage. I'm going to show you why on the next slide. So some kind of report, preferably in Excel, that says these are the products we buy, this is how much we're paying for those products. We'd return a savings analysis for you in about a 7-day turnaround. We need to create an account and register you with MedAssets, and you'll see MedAssets here is the GPO that we're using for all of the physician partners members and the physician resource center members. We would then begin bringing in inventory, and we're going to bring in 3 months of usage. That's why we ask for this material usage here in the beginning, because we're going to make sure and bring in 3 months of usage so to reduce any possibility of back orders and those sorts of things. We would then load pricing contracts, get that done, and probably within 30 days we can begin ordering and feel confident that you'll have all the right pricing, all the savings, and all the products that you need in stock. So currently we do have members of physician partners and the physician resource that are using the Medline program right now. We've seen savings, and Dustin and Veronica have the evidence of this and can be spoken. You can speak to them directly, but the practices have saved no less than 15.5%. and upwards of 33%. So it depends on the practice, depends on what they were paying and their mix of products, but we've seen a 15.5% to 33% savings, and we're hoping that is significant enough for your business that you'd want to get started with us doing this analysis process. We understand many of you have relationships with previous vendors and vendors that you're currently using. At the same time, healthcare is tightening, reimbursements are declining, and everybody needs to make the best business decisions they can to keep their practices profitable and relevant, and we hope that we're a part of that with you. When you provide us the data, this is what you can expect from us in return. We would itemize all the different things you purchased, the unit of measure you were purchasing them in. We would have the quantity that you purchased. It would be longer than this, but I wanted to capture this on one screen for you. But we'd have the quantity that you purchased of all these items. We would show you that this is the price that we're going to charge you for those items, and we'd multiply that out to show you if you bought this many of them over a 3-month period, this is what you would spend. We'd have your current price here that you're paying. Same thing multiplied out. We'd show you line item by line item how much you saved, and then we would total it all for you. And as you can see in this example, and this is a real example for a practice, they saved their expected savings across the board were 17.75%. They were over 1 quarter would save over $2,000, and over the course of a year, we're going to save close to $9,000. $9,000 is a lot of money to most of the practices that are on this call, probably, and something we hope to be able to provide to all of you. Okay. If you move forward with us, every office is provided with customer service representation. So we do have a strong customer service team, a centralized bank of customer service for you. They can help you with day-to-day requirements and IT support and those sorts of things. Both Maria and Kelly would visit your offices on a regular basis. Looking to solve any problems you have, identify new products and savings opportunities, and go through product training on products that you'd be interested in. Very different than your current distributors. Our reps are trained clinically and on product knowledge and do a lot of that kind of work in the office, so you don't have to rely as much on manufacturers. I'm the sales management, so I'd be involved making sure we're doing everything correctly with your office. Dustin, can you hear me okay?
Yeah, you're coming through just fine, Robbie.
I've got it's saying everything good? Yeah, I've got an experiencing network thing on the screen, so I just want to make sure.
You sound great on the receiving end.
Okay, good. And then obviously we do even have an emergency operations phone number, so we have after hours if you need something between 24 hours Saturday and Sunday, you'll see that we have an after hours emergency line, and because we deal with a lot of long-term care hospitals, and so hopefully none of you are working in those hours and would need to call our emergency hotline. Flexible ordering options for your office. You can just order through your sales rep, as many of you probably already do. You can use our customer service. We have medline.com, so a website if you're like ordering on the web. We can do EDI, fax, telephone, any of those sorts of things. So nothing should change from how you currently order unless you want it to change. I'm going to go into a little bit of medline.com so you can see it, but it's similar if you use online ordering systems today. It's very similar. We've kind of modeled it after Amazon. 275,000 products, real-time pricing, contract information, whether it's available or not. It'll show you inventory, all of those sorts of things. You'd go in, we create an order template. So if you go back to when we had the material usage that you submit to us, we use that to create a template. So the first time you log in, all the products you normally order are there in a guide for you. You don't have to search and hunt and peck. You can also view your invoices, returns, credits, packing slips, all of that will be there. And then there's also access to what we call Insight. It's a reporting tool, and I'll show you a little bit more on that. This is an actual screenshot from our product catalog. So if you were searching for this item, and you'd actually click on the Aloe Touch Ice Gloves that we sell, and once again, you'll see our little logo here. We're the manufacturer of these. And so Aloe Touch is a common name in the industry. A lot of people don't realize it's Medline is the manufacturer. But you would see a price per case here, and you would see a lot of information. It would show you who the account name is, pricing, manufacturer contract numbers, and you could even look up MSDS sheets and those sorts of things. Okay. When you click into it, you'll see it'll load it onto, this is a commonly ordered item, and it would load it onto this buying guide just like this. Okay. Once you're going to complete the order and create the order, you'll see it'll just kind of hit here. It'll give you an option if you want to pay by credit card, or you're just going to have us bill your account. You can have that in there. You can put PO numbers in, and here's the delay shipping. If you wanted it, let's say your office was going to be closed, or you only wanted to receive orders on Fridays or those sorts of things, you can do it here. And if you have multiple locations, you can go ahead and switch those right here. Okay. Lastly, I'm going to show you the Insight reporting tool. This is very unique, and this is something that's demanded by larger healthcare systems, but we've got a web-based reporting tool that can track and report your spending, the items you're buying, those sorts of things. And what's a little different about this than other companies is the reports can be delivered automatically per your schedule. So if you every month want a list of all the products you ordered, or you want what are the products we're spending the most money on, or how many back orders did we have, or any of that kind of information, you can use this tool. You'd find the report in the toolbox, and then you schedule it and say, look, on Monday morning I want this report, or on Friday afternoon I want this report, and it would automatically be delivered to you either in Excel or a PDF file, whatever you choose. You can choose it. You can deliver via email. You can report it in your inbox, and you get an inbox with this. So just some options on Insight and how it works. So just kind of summing it up for the physician office, direct manufacturer, we should be able to help lower cost, increase some efficiencies, really increase revenue. That's something we're working hard with Dustin, Veronica, and Ted on finding new ways for the practices to make money. Obviously, we have 32 distribution centers, technology tools, all the things we've talked about in this practice, in this webinar, sorry. And then, one of the fun things we do, I don't know if anyone's ever seen the Pink Glove Dance. It's a national program that we have, pinkglovedance.com, but we have healthcare systems all over the country that participate in this, and this is actually, we are the manufacturer of the pink gloves. So if you've ever seen anybody wearing pink gloves, that's us. We raise a lot of money, and we've raised over $1 million to the National Breast Cancer Foundation, something we're very proud of. Dustin, I'm done, and I can open it up now for any questions that anyone has and see if we can help out.
Great. Well, yeah, thanks for that, Robbie. That was concise and a lot of information, obviously. I wanted just to go back. Yeah, if anybody has any questions, you can type them into the GoToWebinar interface, and we can receive them as they come in. I want to go back to the slide that you had with all of the different savings on it. I think it was the Excel sheet slide. And you mentioned there that the practice there is at 17, almost 18% savings, and you said that equated to an annual savings of $9,000. Is that right?
Correct.
That's
so this was a quarterly usage for a practice, 17.7. So for the quarter, they saved $21.97. So multiplied times 4 annually was almost $9,000.
That's just great. That's great. So as far as the website goes, when somebody becomes a customer and they go through all the process of signing up, you said they basically land on the page or see a page where they show all the items that they would regularly purchase already popping up when they log in?
Correct. So we would take this information that you would give us, that would be these items,
okay,
and we would take those items and load it into what we call a template.
Okay.
And so the first time they go to log in, there would be on the main page, I think if I come here, right here down on the left hand side, you'll see it says order templates.
Oh,
so
okay.
The first time they logged in, they would click on order templates. When they go to order templates, it would be a list of all of those items.
We have a question that's coming from somebody that's attending today. The question is, does Medline offer any injectables? We purchased them through Merck, Sanofi, Pasteur, Allergen, and Bioventus, etc. Do you have any injectables?
Yep. So we do sell all the injectables that your office would currently purchase. However, I will tell you, we don't manufacture those injectables. So the ones that you're probably getting from, possibly, McKesson or Henry Schein or PSS or one of those companies, we'd be able to sell you those. If you're already buying them direct from Merck or Sanofi or one of those companies, I would tell you we'd be hard pressed to save you a lot of money or any money at all. We take a look at that pricing, but those items, if you're already going direct with the manufacturer, it'd probably be hard. I don't want to overstate that we're going to save you a bunch of money there. We don't manufacture our own pharmaceuticals, so that is just a distributed item for us.
The pricing, that you can show the pricing in case they do want to streamline everything through one order.
Absolutely.
Okay.
Absolutely, and we will, and we'd load it into the order templates, and we get them the best price possible. And sometimes we can do better than the manufacturer, but many times we can't, and it just depends on an item-by-item basis.
Okay. Very well. Would you mind also going through the whole GPO and which is MedAssets, and how the relationship again works, just so everybody's clear on that?
Sure, I'll go back to the, I think somewhere in here. So this program was launched in combination with MedAssets, and MedAssets is a GPO. That's a group purchasing organization. Some of you may have already be a part of a group purchasing organization, but MedAssets is one that we use for this program, and it's a great program. And one of the differences between Medline and other companies is because the hospitals, and it's just kind of the best way to say this, is that we've had to model our company, because we started in the hospital business, after what the hospitals require and mandate. And one of the things the hospitals require and mandate is very, very strong contracting and making sure that we're accessing the absolute best cost on behalf of the hospital. And so we connect you to MedAssets, and not only connect you to MedAssets, but then identify the absolute best tiers. So when we connect you to MedAssets, it reduces your cost by possibly 20% on an item, but there might be a tier that reduces it by 30%, another tier by 40%, and so we go ahead and load you to the best possible tier. Sometimes it's commitment levels, sometimes it's the type of practice you are that gets you better pricing, but it's something that we do better than most other companies, and it really stems from our hospital and surgery center experience where they have teams of people dedicated to making sure they're getting the absolute best pricing.
Oh, that's great. Thank you. And Veronica Postada is here today as well. And anybody can reach directly out to Veronica, and she can provide the forms for both Medline and MedAssets and get that whole process going.
We will have the forms available on our website here, most likely by early next week. So if you're interested in starting with Medline and MedAssets, you can go to our website at www.partnersdocs.com and access the service agreements through the
Group
purchasing tab.
Another question's arrived here. So the last question was from the same person. So do we purchase some So we do purchase some injectables through PSS. Those injectables, would you be able to also support?
Yes, we would. No question.
Okay, great. Well, I think that's filled it for all the questions that we've had today, but thank you very much, Robbie, for hosting. And if anybody has any other questions after this today, again, you can reach directly out to Veronica, and Veronica can line up connecting you with our representatives, which is, again, Kelly Lovett and Maria White. Also, this will be recorded and put up on the Resource Center, as well as the slides will be made available for download starting tomorrow. So without that, thank you very much, Robbie, again.
Thank you very much, everybody, and we look forward to servicing you guys and helping you with whatever you need. Have a great day.
You too, everyone. Thank you. Bye-bye.